one thing that we were thinking on LSR is we haven't had very many guests, and I don't think we've had any since we started LSR, talk about male health. So I want you to put that in the hopper: prostate, testosterone. I want to talk with you about liver and kidney. And if you wouldn't mind starting us off with a little segment on giving your perspective on the many disruptions with thyroid function that people are facing and how you help people with that in your ministry, your health ministry.
Scott, we see a lot of thyroid issues, whether it's hyperthyroid, hypothyroid, Hashimoto, and there's several things that you want to look at on thyroid health. And number one is the four no's. The four no's that you want to make sure you're not doing. Number one, you don't want fluoride in your water or in your toothpaste. You don't want chlorine in your water. You don't want bromide. And chlorine, fluoride, and bromide are a little higher on the periodic table, and it prevents the thyroid, according to Dr. George Fletches, from absorbing the iodine that the thyroid needs. The fourth no, Dr. William Davis talked about this many years ago, back in the early 90s. We're seeing a lot more research on it today, and that is wheat. You don't want wheat with thyroid issues. And good chance we may see some issues with corn. We may see some issues with soy, because we're starting to see research coming out that the hybridized corn, which is sprayed with Roundup, the hybridized soybean, which is sprayed with Roundup, is starting to have similar problems that we see with the wheat. Though we haven't recognized it in the thyroid yet, I'd just be cautious.
Yeah, those GMOs with the soy and the corn, that's something our family steers clear from. And we were called crazy conspiracy theorists 20 years ago when we filtered the fluoride out with like a double extra filter on top of the regular one that takes the chlorine and other things out. I'm glad you're mentioning filtering water. That's something I think that's underrated, not from any specialist standpoint, but what I was learning as, young person, I said, I'm not going to ingest that because I don't feel that that's safe. And now, isn't there the latest research and even recommendations coming down from the federal government on dialing back fluoride and seeing that the
Right.
IQ reductions in fluoride exposure are actually dose dependent?
Yeah, it's true. We see the CDC telling women who are pregnant not to use the fluoride. And the challenges there is actually as you're inhibiting the iodine from that mother, then it affects IQ. And this is really cool stuff. So if you take iodine and the mother takes the iodine within especially the first two trimesters, just like you would folic acid, but she takes the iodine through the full pregnancy. And then she takes 12.5 milligrams is the American study. The German study is 25. And then as the mother then starts nursing for 2 years, you go to 25 milligrams for 2 years. And as the baby can start chewing, the baby then goes with 3.125 milligrams. We're finding that the child's IQ is 10 to 15 points above the mother's IQ. We're also seeing immenses in those babies. And so I'm sure that's very interesting to you as a past school teacher. And that was picked out actually out of the school system when they were noticing these menses coming through the school system in that county, where there is the research was being done in that county. And so what happens is, as you do the fluoride, as you do the chlorine, as you do the bromide, it inhibits that absorption of the iodine, and that can affect cognitive function.
Fascinating. So that's why it's harming IQ. And the more fluoride exposure, the greater the hit to the IQ they're finding as
Absolutely.
well. Now, when you mentioned, by the way, my wife had Hashimoto's, and it became a thing where, okay, I'm going to get off gluten. You mentioned gluten, and maybe not everybody, but at least she was needing to do that. And the thyroid medication that they had put her on, she was able to drop that in half just with that one
I
action
believe
of
it.
avoiding gluten, nothing else. And there's been other things that she's been working through the years on
Yes.
that.